Hello, everyone. I hope that all of you will be fine. And thanks for taking your time to join this session. Uh, Dr. Aruz and I will be conducting this session, and it will be about the general approach of a counseling-based station, that how to approach a station and how to do it in a better way. Uh, as we will be recording this session for those people who are unable to join this live session, so it is requested to you, kindly please keep your mic mute so there is no disturbance in between. Thank you again. So let's just start the session. Okay, so let me just give you a brief overview. We will discuss that how to identify that if it is a counseling based station from the description given outside, what to expect when you go inside the cubicle, how to start a station, how to divide the time, and what are the main task achievements in a counseling based station. And we will use one example as a reference to make it more specific and understandable, because if I'll be just telling you that in a counseling based station you need to do this in this situation, this in this situation, that will be so much general. So we have put one example to use as a reference, just to tell you that if this is the scenario, so what pathway you need to follow to proceed the station. First of all, when you will be standing outside the cubicle, you will have 90 seconds and there will be a description of the station given outside. So what you should be doing during those 90 seconds? The first thing, you should read that what is the setting in which you are present. If it is a GP clinic, if it is A&E or some specific medical or surgical department. Most of the counseling stations, they will be not in A&E, okay, but it's not absolute that you cannot have a counseling based station in which you will be present in A&E. But a general perception is most of the counseling station, your station will be either a GP clinic or some medical department or surgical department. The next important thing is you should emphasize on the name and age of the patient. Just the age also give you some clue about the diagnosis and the management of the patient. The next important thing is what is the presenting complaint or what is the specific scenario. Just like we previously discussed the history based stations, in which we told you that the patient will come with one complaint, for example a chest pain. What's different in a counseling based station, you might be already given a diagnosis or you might be already given some labs, so you already have an idea what might be the patient's condition. Okay, you might be having a clear cut diagnosis already. Okay, so this is a specific thing which will indicate you that this is a counseling based station and not a general history based station. In a history based station, only the complaint will be given. In a counseling based station, you will be given a diagnosis or some specific investigation which will like almost 90% indicate what's the diagnosis. Okay, next important thing is the special note. Sometimes there can be some special note. For example, the BNF will be inside the cubicle, or there will be some chart which you might need to explain to the patient. That varies upon the particular station. Okay, some of the counseling station may have some specific note and some may have not. Next important thing is, while standing outside the cubicle, you should plan your station, that how I am going to perform when I will enter the cubicle. And as we previously discussed, that there are different time divisions for history based station, counseling station, and the ethical scenarios and the examination stations. In a counseling based station, you should give more time for the counseling part or the diagnosis and management part, and less time should be given to the data gathering or the history. The general outline is 2 to 3 minutes for data gathering and around 5 to 6 minutes for the diagnosis and management. Okay, so you should be already clear in your mind that I don't have to go into too much detail of the data gathering, because it's a counseling based station and the core of the station is to do the management and the counseling. The last important thing is, depending upon the scenario which is given to you, just revise in your mind what are the specific history questions which you need to ask over here. And it is really important because sometimes you might need to skip many questions just to save your time. So you have to just be specific regarding the scenario. And you also need to revise in your mind what are the main key points of the counseling and the management I should be emphasizing on. Okay, so that before you enter the cubicle, you have already made a plan in your mind that how are you gonna start this station and how will you perform it. Next is, uh, I'm gonna give you an example of a scenario which will be given outside a cubicle. It is a counseling based scenario. Let me read it for you. You are a FI2 in the GP clinic. So first thing which we told you is that you should be knowing what is your setting. So over here it's written you are in GP clinic. Mrs. Emma is 55. The second most important point was name and age of the patient. And the third thing is, what is the problem, or what is the reason the patient has came to you. So it's written the patient came to the clinic for the health checkup. So now you already know that the patient has came for the routine checkup. All the blood tests, including the blood sugar, LFTs, urea, and electrolytes, came back normal. Only cholesterol was found high, and her Q risk score is 14%. She should be on statins. Please talk to the patient, discuss your initial plan of management with the patient, and address her concerns. So, by just reading this description, you already know that there was no complaint of the patient. She was just there for a routine checkup, and you have already got the lab results that blood sugars are normal, LFTs, urea electrolytes are normal, and only cholesterol is high. So you already know what is the diagnosis and what is the management plan, which is given that she should be on statins. Okay, so now you only need to ask a few questions about the history and emphasize more on the management part and address the concerns of the patient. Okay, now the bell rings, you move into the cubicle. What to expect, what would be there? There will be a person who will be a simulator, I mean the patient. In the counseling based station, nowadays, there won't be any examiner. Okay, they will be assessing your performance from a receiver. They'll be listening to you. There will be a phone receiver inside the cubicle. There won't be any examiner. So what you need to do when you enter the cubicle, just go inside, close the door, sit on the chair. There'll be a simulator sitting on a 6 feet distance from you. Maintain that distance. First of all, you will have to tell your name and the GMC number as your identification for the examiner. And you don't need to say it in a complete sentence. For example, my name is John Smith and my GMC number is 123456. No need to waste a few seconds on that. Just say John Smith 123456. You are done with your identification for the examiner. Now you need to proceed to the patient. Greet the patient. Like, the greeting is general. It is general for history based station or a counseling based station. You have to just greet the patient by saying hello. Give a bit pause, let him say hello to you, and then introduce yourself. My name is Dr. XYZ. I'm one of the doctors here in this department. For example, in this specific scenario, you have to tell the patient that I am one of the doctors in the GP clinic. Okay, so next thing is, you have to confirm the name and age of the patient. Just ask the patient, may I confirm your name and age, please? You were already given the name and age outside the cubicle. You have to just confirm it. And from over here, the counseling based station gets different from a history based station. For example, in a history-based station, you are given only a complaint of the patient. For example, the patient has came with the chest pain. So your opening sentence for the presenting complaint is, how may I help you? And the patient will tell you, doctor, I'm having the pain. And you start asking more questions about the pain. But over here, you already know why the patient came, and she has already got some blood test done. So if you will just ask, how may I help you? The patient will say, doctor, I came for the well-being checkup and you already have my test. Now tell me those. So it's a better idea if you will start like this. From your notes, I can see that you came for the well-being checkup and we have got your test done. Okay. Before I discuss those reports with you, is it okay if I ask you a few questions? Okay. Because you only know that the patient's blood sugar is normal, LFT is normal, urea electrolytes are normal, and the cholesterol is high, but you don't know the history of the patient. Although the patient was not symptomatic, but you have to take the history to know what are the risk factors, why the patient had high cholesterol, or what else, what other risk factor the patient is having uh, as a risk factor of cardiovascular disease. As it was mentioned in mentioned in the description, the scenario of the station, that the Q risk score is 14%. Q risk score is actually a predictor that what are the chances of having a cardiovascular event in next 10 years. So you have to ask in the history that what other risk factor the patient might be having. Don't go into too much detail of the patient. Okay, just ask a few questions. As the patient did not came with any complaint, just ask him, how's your health in general? The patient will say, I'm normal. Okay, why you got those tests done? The patient will say, I was just here for a routine checkup. Okay, do you have any symptoms? No, doctor. Any symptoms in the past? No, doctor. Okay, good. Move on directly to the past medical history, because when there is no complaint, there is no history of present illness, there is no systemic review. Just move on to the past medical history, because you have to save your time in the data gathering part. You have to spend only 2 to 3 minutes for the data gathering, and you have to save the rest of the time for the management. Okay, because the core of the station in a counseling based station is the management part. So when you will move to the past medical history, just ask the patient. You already know that the patient's cholesterol is high. So you should tailor your questions accordingly, which can be relevant to a high cholesterol. You don't need to ask each and everything in the past medical history as well. For example, just ask the patient, have you been diagnosed with any medical condition? The patient might say yes or no. Even if the patient says no, uh, you have to ask him some specific questions. For example, the patient does not know, but you know, apart from the high cholesterol, what are the other risk factors which might be uh, important as a risk of cardiovascular event. So ask the patient, do you have any diabetes? Yes or no. Do you have any high blood pressure? Yes or no. That's it. Move on. Surgical history. You may ask about the surgical history of the patient, but as I already told you, that you have to specifically tailor your question. Don't ask each and every question in the counseling part. So you can omit the surgical part here. Surgical history is not important considering this scenario. Medication history is important. You have to ask the patient, have you been taking any medication? And that is important because uh, you are supposed to give the statin in the management part. So you should be knowing if the patient is already on some medication, because there can be some drug-drug interactions. Drug and food allergy. This is an important question, because sometimes the patient might be allergic to some medication. Though statin allergy is not that important, but to be safe doctor, you should always ask about the drug and the food allergy. Next thing is the family history. Ask an open-ended question. Does anyone in your family has any medical condition? If the patient says no, you should be asking some specific questions. I'm taking this high cholesterol scenario as a example, uh, and I'm leading you according to that. So the questions I'm telling you over here are based on this example. In different scenarios, your question might be different, but the scheme generally follows this pattern. So after you have asked about the family history, you can specifically ask the patient, anyone in your family having a high cholesterol? No. Anyone in your family having any heart condition, diabetes, blood pressure? Okay, because you know as a doctor that these are the significant risk factors for having a cardiovascular event in the patient as well. So after these questions, move on to the social history or the personal history. And always remember, even if it's a history-based station or a counseling-based station or any station, Before asking the personal history questions, you have to signpost the patient. And by signposting, I mean you have to tell him, now I'm going to ask you a few questions which might be important in your situation. Or if you know a complaint of the patient, you can say, which can be relevant with your condition or your complaint. Why this signposting is important? Because if you will start asking the questions about the smoking and the alcohol, the patient might be a bit alarmed that why are you asking these personal questions. So if you will just signpost, he won't be alarmed and he will be telling you questions in a normal way. One important thing, personal history or a social history is really, really, really important in a counseling based station. Just like in a history based station, history of present illness is really important to make a diagnosis. Over here, just taking it as an example that the patient has high cholesterol, you want to know what are the risk factors in the patient's life which might be causing him high cholesterol. Because the main aim of the data gathering in the counseling station is to know the risk factors so that you can address those risk factors in the later part of the station, I mean in the management and the counseling. So this is the most important over here. Generally, you have to ask the questions about the personal history, which includes smoking, alcohol, diet and physical activity, work, and the stress. For example, the patient might tell you that, doctor, I work in an office and it is a sitting job. That indicates the patient might be having a sedentary lifestyle. Okay. And the next important question is, with whom do you live? Because sometimes in a counseling based station or in any scenario, the patient might need support and help of someone who can provide the care to the patient. Okay. So you have to ask about smoking, alcohol, diet, and physical activity. They are clearly related to the high cholesterol. So these are the important question which you cannot skip. Okay. And IV drug abuse and the sexual history, these are just a general questions which you might ask in a lifestyle habits or the personal history, but you have to decide that only ask these questions where they are relevant. For example, in this scenario, having high cholesterol or a high Q risk score, IV drug abuse or the sexual history are not that important, so you can just skip this part. But in some other counseling based station, in the lifestyle questions, you might need to ask them. Okay. So after you have taken the social history, now you know what might be the possible risk factors or what might be the areas of the concerns of the patient which you need to address in the later part of the consultation. The most important thing in any of the station is the eyes. What are the ideas of the patient, what are the concerns of the patient, and what specifically the patient is expecting from you. For example, if you'll just ask the patient, do you have any idea mm, about your condition, the patient might say, doctor, I am just here for the routine checkup, and I'm expecting you to tell me the reports. Do you have any particular concern? The patient might tell you some particular concern and may not, as she has not got her reports yet. So eyes is really important. Always try to put the eyes questions in any of the consultation, even if it's a history based, it's counseling based. So after asking the eyes questions, now you have taken a brief history. Now you know what are the risk factor of the patient, and now you have to proceed to the examination part. In the examination part, there are some general universal things which you have to mention. That is the vital signs, and the further clinical examination depends upon what is the actual presentation of the patient. Okay, for example, considering this scenario, you will have to tell the patient that now I would like to examine you. I would like to check your heart rate, blood pressure, temperature, breathing rate, oxygen content in your blood. As the patient just has a high cholesterol, she does not have any of the symptoms, so there is no specific clinical area or the like clinical examination which you might need to do, like the chest examination or the abdominal examination. So what's important or relevant over here is, after the vital signs, You have to tell the patient that now I want to do a detailed head to toe examination. Head to toe examination means the general physical examination. And the next important thing to be mentioned, considering this example, is the BMI of the patient. That I would like to check your height and the weight. Okay, don't say BMI to the patient, use the simple words. And in any of the examination, you have to tell the patient that I will ensure your privacy and I'll have a chaperone with me. Sometimes you might need to do some initial investigations in a history based scenario, but over here, as I already told you, in a counseling based station, you will be already given some investigation. So before starting the station, you ask the patient that I have your reports, but I will come back to that in a short while. Let me ask you a few questions. So now you have asked those questions. So now you will have to explain those reports to the patient in the simple words. For example, the reports you have got over here is the blood sugar levels, LFTs, urea electrolytes, and the cholesterol. So you have to tell the patient that we have checked your sugar levels, they are normal. We have checked your, we have done the test to assess the function of your liver and the mineral content in your blood, which is also fortunately normal. The only thing which is raised is the cholesterol. Okay, so you have to tell the patient those reports in the simple words. After telling those, ask the patient, do you have any idea about the high cholesterol? Okay, the patient might tell you, no, doctor, I don't have any idea. Okay, or sometimes the patient might tell you, yeah, I know what it is. So when you tell the diagnosis to the patient, tell in a medical term, clearly in a medical term, and then explain it in the simple words which are understandable by the patient. I mean, don't use the medical terms when you are explaining a situation in detail to the patient. Considering this scenario, tell the patient that you have high cholesterol. Have you got any idea? No. What the cholesterol is? If the patient says no, explain him what the cholesterol is. After telling him, ask him, have you understood it? Because these are the IPS questions and the IPS areas that you have to involve the patient in the consultation. Keep on asking the patient that, have you understood? Do you have any questions so far? Okay, so after explaining the diagnosis to the patient, now you may ask the patient, would you like to know what I'm going to do for you? And now here begins the management part. Okay, so let me just conclude it again from the examination to onward. In the examination, vital signs are always important, and head to toe examination is also the general thing. Depending upon the condition of the patient, you have to tailor the clinical examination. That if you want to do a chest examination, abdominal examination, for example, in this scenario, the BMI was important, so you have to tell that. As you have already got the investigation, so you have to explain those investigation to the patient. And now, based on the investigations and little history you have taken from the patient, you have made a diagnosis that the patient has high cholesterol level. First of all, ask the patient, does the patient has got any idea what is the condition? If the patient says yes, ask him. If the patient says no, explain it to the patient. Try to explain it in simple words. Try to involve the patient that, have you understood everything so far? Do you have any question? These are the IPS questions. And then you begin the management part. From now onward, Dr. Aruz will explain to you how to proceed in the management of a counseling based station generally. And she will also uh, tell you specifically considering this example. So Dr. Aruz, now you can start.
Thank you, Dr. Adnan. I hope I'm audible to everyone. Well, Dr. Adnan has explained very well all the steps or the approach that we need to use in the counseling stations. Now, the for the management or to be able to complete your management in a calm way and to be able to address all the concerns, it is very, very important to keep an eye on your time. Time management is very crucial. Although it is a counseling station, still you will be marked for the data gathering and for the IPS. So do not forget those. But Just keep your data gathering or your history brief so that you can give enough of your time to counseling the patient in counseling the patient. So in the management, your counseling should revolve around the patient's concerns. This is very important. So for example, if the patient asks you from the beginning in the opening sentence, Doctor, I'm worried about stroke, your management now should address the patient's concern first. So for example, Sarah, you told me that you're worried about stroke. We need to talk about a few things, and then blah blah blah, you talk about the rest of the things. If the patient has not given you any concerns, you have to ask the patient's concerns first, because again, it should revolve around the patient's concerns. So before we move on to how I can help you, do you have any concerns in particular that you want me to talk about? And you start talking about that particular thing. Do keep in mind that bombarding the patient with the information that you have will not give you marks. Addressing the patient's concerns will give you marks, even if you're left with anything in the management, any treatment or anything at all. Then we provide the patient with the initial treatment. So as for this scenario, as we know that the patient came for a general checkup and the cholesterol is high. So what you need, and it's also mentioned, they have given you a clue that she should be on the statins. So what you do is you tell the patient that, as Dr. Adnan already told you, you tell the patient whatever, explain the results and tell them what you're going to do now. So you will be informing your seniors wherever needed. Most of the cases, it is needed that you should be informing your seniors, and you should start them on the initial treatment, which is the statins. So we will be starting you on some medication that will lower down your cholesterol. Are you getting me? Yes, doctor. Do you have any concerns? The patient might ask you, doctor, are there any side effects of this medication? Yes, unfortunately, this medication has this side effects. It can elevate your blood sugar levels, etc. etc. You go through all the side effects. And do you have any questions for me now? Keep asking the patient for any questions, any concerns. No, doctor. Okay. Then you start talking about the lifestyle modifications. So when you ask the questions, or when you were asking for the lifestyle questions, the patient might have given you a thing or two. Like for example, a sedentary lifestyle. The patient is not exercising because he or she does not have the time to do so, or the patient always has takeaways because the patient does not have time to cook. So you need to address those concerns or those lifestyle modifications one by one, keeping the patient following you. Again, do not bombard the patient with a lot of information. You might lose the patient in between, and you might lose score as well. In the counseling stations, lifestyle is very important. So if the patient gave you smoking, you address the patient's smoking concerns. If the patient give you more than one or two, lifestyle problems, address all of them in brief, and do not forget to give them a leaflet so that they can go home, they can read about it, so the examiner and the patient both know that you were to talk about it, but you did not have time. Also, in some of the stations, we have some general advices that we can talk to the patient about. So, for example, if it's a hypoglycemic station where the patient has hypoglycemic attacks, you give them general advices of how to keep some sugary things with them. If it is the warfarin station where the patient is recently started on warfarin, we give the patient general advices of how to avoid long term sitting or standing, how to keep walking around, how to avoid contact sports. These are all the things that we will be discussing in detail, but just to give you an idea of what we mean by the general advices. Now, sometimes we might tend to forget the psychosocial aspects. However, it is very important to show them that we are a safe doctor. So, for example, if a patient comes to you with recurrent episode of stroke or recurrent TIAs, it is very important for you to understand and realize that driving is something very important. So you need to ask the patient about the driving. You need to address the driving. Although this is not a lifestyle modification, this is not the main part of the treatment. Why? Because you are a safe doctor. Also, in some of the stations, you need to arrange a follow up for the patient. So, for example, if a patient comes to you with high blood pressure, Actually, the patient comes to you for a general checkup, and today, when you measured the blood pressure, it was elevated. This is the first reading that you had of the elevated blood pressure. What do you do about this? You call him for another follow up where the blood pressure will be checked again, and if it still remains elevated after consultation with your seniors, you will start him on some certain antihypertensives. Or if it's a patient with let's say this particular station with the patient has come with the elevated cholesterol level, you need to arrange another follow-up to make sure that the patient is following the lifestyle modifications and the patient is compliant with the medications, and the cholesterol level is within the normal range. Now the last and the very important thing is the warning signs or the safety netting. It is very important to safety net the patient even if the patient has is completely fine, is healthy, and has no problems, as in this station the patient just came for a general checkup. But because the cholesterol level is high, you have to tell the patient that your cholesterol level is elevated. So in case anytime you have any sudden severe chest pain, any weakness in any part of the body, or any slurred speech, please immediately call 999 or come to the hospital. So these are the few things that you need to take care of even in the counseling stations. The IPS should be going on side by side, although the patient gave you no concerns here. But that does not mean that the IPS you will not be scored for the IPS. Every here and there or every now and then you have to use your IPS lines, which should come to you very naturally. And how will that happen? That will happen with continuous practice with different kind of people, because from different people you will get different lines that you can use in your daily approach, and it will not seem like this is something that you've learned and you're giving it to the patient. So these are the few points that we discussed here, and if you have any questions, please do leave them in the chat box so that we can answer those for you.
Okay, Dr. Rose, how many minutes are left for the
3.
session? Okay, what about if you just end this session and we'll send another link
Okay,
and let
sure.
the join it again. Okay.
Before I end the session, Dr. Indu, thank you so much.